Hi, everyone, and welcome. We'll go ahead and get started on this healthcare roundtable. If at any point you get disconnected from this Zoom discussion, please feel free to join our conversation on any one of the live streams on Congressman Smith's social accounts. We'll be live streaming on YouTube, Facebook, Instagram, Substack, and X. Thank you again for joining this webinar about healthcare and the Affordable Care Act enhanced premium tax credits. Today, we will hear from Congressman Adam Smith of Washington's 9th Congressional District, as well as from special guests from across Washington State. Those special guests include Washington State Insurance Commissioner Patty Kuderer. We have Lisa Yohelem from HealthPoint, Ingrid Ulrey from Washington Health Benefit Exchange, Dr. Vin Gupta, a public health physician and NBC News medical contributor. We have Decker Dirksen from Community Health Plan of Washington, and Monique Valenzuela from Ventures Nonprofit. Before we get into the discussion and Q&A portion of this afternoon, I would like to turn to Congressman Smith for some opening remarks.
Great. Thank you very much, Carly. I appreciate that. And thanks to our very distinguished panel of guests who have joined us. I'm going to leave the bulk of the time for them to explain some of the details of that. I just have 2 points that I think are important to frame this. One is about the government shutdown, and second is about what the ACA is trying to accomplish and how it fits into the larger healthcare system. I know there's a lot of consternation about why we did not continue to fund portions of the government past October 1st, and I want to make sure people understand. First of all, the Affordable Care Act subsidies were set to expire at the end of this year. And the point at which you have to start deciding which healthcare plans you're going to pick is November 1st. There was urgency for dealing with the cost problem. Now, sadly, we sit here on November 4th, and the Republicans in the House of Representatives have refused to even be in session, refused to negotiate or have any discussion about that. So the crisis is upon us, and we're going to have to figure out other ways to deal with it. But second, there's a broader issue at play. And it's really important to understand what the budget is. It's the discretionary portion of the budget, which is roughly 29% of the overall federal budget. There's a lot of the federal budget that keeps going, even when we don't fund past October 1st. Social Security, Medicare, Medicaid. But the problem that we had was the budget was basically developed in the Republicans' budget reconciliation plan. The so-called big, beautiful bill. I try not to say that, but just so you know what I'm talking about. And that set all of the priorities. And that was done on a purely partisan basis. Only Republicans voted for it in the House and the Senate. And they had the votes to do it. They didn't need 60 votes. And to assert, I disagree with it. I do not like that budget, but that's the democratic process. Reconciliation is part of it. They had the votes. They went forward. But as we hit October 1st and the yearly appropriations, which that budget reconciliation bill impacted, ran out, we had to continue it. And at that point, Republicans did need Democratic votes in order to get to the 60 vote requirement that the filibuster rule has in the Senate. So they got 53 Republicans, they needed 7 Democrats. So now you were asking 7 Democrats to vote for all of the things in that budget, which clearly we did not like. And you can argue with Democrats about that. But the cuts to Medicaid, the cuts to SNAP and other food programs, the president's elimination of the Department of Education, elimination of the USAID, the firing of a couple 100,000 different federal employees, all of these issues, an additional $170 billion for Department of Homeland Security, as opposed to these were not priorities that were supported by Democrats. And then all of a sudden they were asked to vote for it. Normally, the way the filibuster is supposed to work, it forces bipartisanship. You got to get 60 votes. You got to get consensus. So if you were going to get those votes, you would have to say, okay, got to be stuff Republicans like, got to be stuff Democrats like. Well, the Republicans under President Trump, then Speaker Johnson, said, no, we're going to not negotiate with Democrats and not talk about their priorities. We're simply going to expect them to vote for our budget. Well, that's a very difficult thing to do because some of us feel very strongly that what President Trump is doing with the federal government is wrong on 1,000 different levels and don't want to be seen as voting for it. So that is what has led us to this point. Now, I will say this week, as we've seen that Republicans are not going to deal with the Affordable Care Act issues, and that they're already upon us, there are negotiations about how we move forward from that. But it was really important, I think, to have this discussion. And that's not to say that there isn't severe impacts of having that portion of the government not being funded. A lot of federal employees furloughed, not paid, services being reduced. We are aware of that and trying to figure out how to fix that. On the ACA specifically, let's understand the ACA is the Affordable Care Act is part of how we try to help Americans afford health insurance. It is not a cure-all for the problems that our healthcare system faces. We spend more money on healthcare than any other country in the world by a very comfortable margin on a per capita basis. We don't get the results that we should. We need to spend that money better. Number one biggest issue, too many people are not covered. The Affordable Care Act had a huge impact on that. In Washington state alone, we went from 12% of our population being uninsured to 4% being uninsured. It helped. We don't want to go back to 12%. That's the biggest reason that we want to extend these Affordable Care Act subsidies. I know they were added during the pandemic, around the pandemic, but the crisis in unaffordable health care transcends the pandemic. Now, final thing I'll say, look, we don't have to extend, to my mind, every single aspect of it. If Republicans want to negotiate a different solution, I'm open to it. But I'm not open to doing nothing about the fact that millions of people are about to lose their health insurance and see their costs go up. We need to have that conversation and move forward somewhere. So I look forward to discussion. I'll turn it back to Carly to introduce our next speaker.
Yeah, thank you, Congressman Smith. I'd like to give our other panelists a chance to introduce themselves as well. Firstly, I will turn to Washington State Insurance Commissioner Patty Kuderer.
Thank you, and thank you, Congressman Smith, for bringing us together today for this really important discussion. I am Patty Kuderer, Washington State Insurance Commissioner, recently elected last year, just took office in January. And as your insurance commissioner, I oversee our individual health insurance market in Washington State. My office approves the health plans and reviews the rate changes that insurers request. Open enrollment started this past weekend, and I know that some people are experiencing sticker shock. And I know these prices are going to be hard for people. We approved 14 insurers to sell plans for next year, and the average rate change was 21%. That was actuarially justified, and according to the statute, we were required to approve that. That doesn't lessen the pain that people are feeling, though, with the impacts of the increase in the premiums. So we worked with our exchange to do everything we could to lessen the impact of the decisions coming from the other Washington. But it may not be enough to help ensure those most affected that they will be able to keep their health insurance. That said, I want people to reach out before assuming that they can no longer afford their healthcare premiums. Because how much you pay for coverage will depend on a number of factors, including where you live, your age, the number in your family that you are insuring, and the plan that you select. Most people who shop on the exchange qualify for tax credits to help lower their costs. I know Ingrid, who's coming up next, will speak to this in more detail. Tax credits help people afford coverage for themselves and their families. The original tax credits under the ACA are permanent. It's the enhanced premium tax credits we're talking about today, and these have helped more than 200,000 people afford coverage here in Washington State. These are the ones that are set to expire if Congress does not act very soon. And it's not too late for a vote, but it's getting close. Without these tax credits, we expect as many as 80,000 people could drop their coverage. Washington State had reached a record low uninsured rate of 4.8% thanks to the Affordable Care Act and these enhanced premium tax credits. This number will soar if Congress fails to do its job. And it's not Congress or the president who will face medical bankruptcy. It's the millions of individuals and families across America buying their own health insurance who will face the difficult decisions of paying for insurance or rolling the dice. I believe that healthcare is a human right, and that as elected officials, we're entrusted with great responsibilities. And today, the Republican-controlled Congress and this administration is failing the very people who need their help the most. Thank you.
Thank you so much, Commissioner. Let's turn now to Lisa Ulrey from HealthPoint.
Thanks. Thank you, Carly. Good afternoon, everyone, and thank you, Congressman Smith, for inviting me to join this panel today. I'm Lisa O'Hallam, and I am the CEO of HealthPoint. HealthPoint is one of the largest federally qualified health centers in King County. We provide comprehensive primary care services, including medical, dental, behavioral health, and pharmacy services across suburban King County. 10 of our main locations are in Congressman Smith's district. We are part of a larger primary care safety net that includes other community health centers in the region. Community health centers serve everyone in our community, regardless of their ability to pay or whether they have insurance coverage. And I am grateful to be here today with others to discuss the changes to healthcare coverage and access and to share my thoughts on impacts to the community.
Thank you, Lisa. And now we'll turn to Ingrid Ulrey from Washington Health Benefit Exchange.
Thank you. And thank you, Congressman Smith, for your leadership. And it's just great to see everybody else here on the panel across these different stakeholder groups. A lot of us know each other and work together day in, day out to expand access to coverage and care for all in Washington. This is a really pivotal moment. We just opened our doors for open enrollment here at the Washington Health Benefit Exchange, as Commissioner said. So on Saturday morning, people started streaming in. And what they're finding is super complex this year, because as noted by the congressman, a couple of things are happening. The so-called beautiful bill, I'll call it that as well, the so-called, has changes in it that will over time make it harder and harder for us to get and keep people covered. And immediately 10,000 of our lawfully present immigrants in the state of Washington will lose eligibility for any level of tax credit, not just the enhanced tax credit. So on top of that, we have the ongoing uncertainty of whether the enhanced premium tax credit will indeed expire as scheduled at the end of this year, the calendar year, or if Congress will come to a deal to extend it. So it's in that context, our customers are seeing very different impacts on our market. The people impacted the very most are those who are above the income cap and who will lose access to all tax credits altogether. So 26,000 of our customers are going to come in. They are the ones truly seeing sticker shock. They tend to be our customers who are small business owners, self-employed, older adults, not yet on Medicare. So just a couple of examples, and then I'll turn it over to the next speaker and we can come back for more discussion. Think of it as an older couple earning about $85,000 a year together. A typical case we would be paying $450 in premiums for this year, plan year 2025, and now they're looking at an $800 premium per month. This is an actual data point. The next one, a family of three, a couple in their early 60s, so having with a dependent 21-year-old, income just over $130,000. Their premium for a bronze plan increased from $662 per month to $2,478 per month. And the problem here is when we get prices this high, people are making really hard decisions. They're trying, what am I going to do? As one of us, we're going to have to go get a separate part-time job that hopefully offers health insurance. Are we going to have to stop paying for bills for other necessities? Are we just going to have to give up and become uninsured? So those are real decisions. And believe me, I've heard from people struggling with this this past week. So more to come, but I just wanted to highlight the sense of urgency around permanently extending the enhanced premium tax credit because it's excellent policy. It's had all the intended effects. We've had the most robust enrollment through our state-based exchanges and nationally through the ACA ever. And that saves everyone money and is helpful and important in maintaining the stability of our entire health system. So thank you again, Congressman Adam Smith, and back to you, Carly.
Amazing. Thank you so much, Ingrid. And next we'll turn to Dr. Gupta.
Hello, everybody. Congressman Smith, thanks for inviting me and thanks for having us for this important conversation. I could re-echo everything that has been said, but I'm going to give it a different spin. prior to these tax credits, just to give everybody a sense here from a clinical standpoint, I'm a pulmonologist. I'm actually on night shifts this week at a downtown hospital here in Seattle. What did we see prior to the tax credits and to this expansion of basic primary care for Americans across the country and here in Washington State? We saw that 4 in 10 patients experienced a delay in getting basic access to a test for flu, now COVID-19, or for any infectious disease. They experienced a delay of at least 48 hours, coupled with a delay on the back end of that test of an additional few days. And so what would happen? Somebody wakes up with flu-like symptoms. 4 in 10 people prior to this expansion of healthcare across the country would experience a critical delay in getting tested or getting, say, Tamiflu if you had flu, or if you had a bacterial pneumonia, an antibiotic. What's going to happen? I see this in my clinical life all the time at the bedside that people end up in our intensive care units in Washington State and across the country because often they experience a delay in diagnosis and an access to treatment, a timely ability to access care in that golden window. And that's what's at risk here. Take the numbers out of here for a second. What's the patient level risk to families, regardless of political affiliation? It's delayed access to care, especially as we're entering cold and flu season. I'm a pulmonologist. I'm seeing the impacts of this at the bedside. It means people are going to end up on ventilators. It's sad. It's preventable. And that's exactly what's going to happen. We've seen it here from the panelists. Disruptions to community health centers like HealthPoint that provide critical basic primary care. That's the type of primary care that gets people timely access to tests, to antibiotics, to antivirals. We just talked about the increases in premiums. What is that going to mean? That means people will defer care like they did prior to this expansion of healthcare across the country through the Affordable Care Act. We're actually also seeing on day one of the shutdown, Congressman Smith and I talked about this a few weeks ago, the expiration of Medicare telehealth flexibilities. That means if you're a Medicare recipient and you want to get triaged for flu-like symptoms, but you don't want to go drive into a clinic or into a busy downtown area, maybe you could just do a virtual session with your provider. You can't do that anymore because the shutdown eliminated that capability for a lot of health systems across the state and across the country. So really what's at risk here is receiving care in that critical golden window for a large majority of our state and for our country.
Thank you very much, Dr. Gupta. Next, we'll go to Decker from Community Health Plan of Washington.
Thank you. And thank you, Congressman Smith, for having me here on this panel. And as Ingrid noted, it's really nice to be on a panel with all of these other people that I work with so closely. I'm Decker Dirksen. I'm the Director of Public Policy for Community Health Plan of Washington. We are the only local not-for-profit Medicaid managed care plan in the state. We were founded by the state's community health centers some 30 years ago now. And so 21 of the 28 community health centers in the state govern us as a health plan and is who we really work for in the work that we do. We have about 340 members on our plan total. The majority of those members are in Medicaid. And when we enter other lines of business, it is primarily to support our Medicaid lines of business. So we have about 14,000 members in Medicare, 300,000 members in Medicaid, and currently about 28,000 members on the exchange who are, most of these individuals are benefiting currently from the enhanced premium tax credits. In fact, we have about 94% of our members receiving some sort of financial support in the form of premium tax credits today. We anticipate that we will likely lose about 9,000 members if these enhanced premium tax credits do not get extended. These are 9,000 individuals who will likely go without insurance in 2026. As Lisa noted, means that there's more uninsured people walking into her clinic who should otherwise be covered. I will note, and Ingrid touched on this a little bit earlier as well, there were gaps in the Affordable Care Act, primarily gaps for older adults and a lot of middle-income Americans that did not have access to premium supports. These enhanced premium tax credits, for the first time, provided those supports to a lot of individuals that were previously left behind. So I just note that it is essential that these enhanced premium tax credits do get extended in some form to ensure people do continue to have options for affordable health coverage in this country.
Thanks, Decker. And now we'll turn to Monique from Ventures Nonprofit.
Thank you, Carly, and thank you, Congressman, for bringing us all together. My name is Monique Valenzuela, and I'm Executive Director and CEO of Ventures Nonprofit right here in Seattle in the Congressman's District. For over 30 years, Ventures has helped low-income individuals in the Seattle area attain entrepreneurship and self-employment through business basics courses, but most of all through our micro-lending arm. Right now, we have on average 370 active clients that have a dream and they have big dreams, but very small margins. Ventures helps educate our businesses and how they can launch, be licensed, and whether they're thin credit or no credit, we provide them with microloans as low as $300. And 20 years later, allow them to buy real estate and become functioning businesses in this city. Our alumni include James Beard chefs. They include other people in commercial real estate. But what I know to be true is in this state, when businesses close between years 2 and 3, they are 10% more likely to be women and veteran owned businesses. Ventures exist for those clients. Every year, we lend out and give grants up to $1 million deployed in our communities for business expenses, rent, capital, leases, equipment. Now, my staff is faced with clients coming to us saying, what's going to happen when these benefits expire? We didn't coach in our P&L or our business planning about this. One thing business owners need is certainty. And the ventures client is one that has picked themselves up through poverty, invested their grit and their heart, and they're your neighbors. They rent the empty storefront, they take a chance, and they invest everything to become tax-paying, job-creating business owners. With the uncertainty of these credits expiring, you're looking at a pipeline now that they no longer have access to. And much like my co-panelists have talked about making decisions, my micro business owners and nano business owners are daycares. They're mechanics. And if they go out of business, that's one less daycare provider and one less parent that can go to work, no matter what it is. Yes, we face some of the repercussions of the tariffs and of the government shutdown, but with expiration like this and what we're facing, that's one more unexpected cost that not only do my long-term coaches and trusted community members have to quickly be educated on, when we go out and give these microloans and grants, we don't take into account that there's going to be thousands of dollars now that they're going to have to come up with or cut positions in their very own community, those very own low income community members that we tend to lift out of poverty. So I'm excited to share how this is going to be effective and how it's going to affect our clients that we serve, because our job is to keep business open in their first 5 years of launch. We do that through education training, we do it through credit, and we do it through every knowledge that we have. But unexpected expirations like this are not something that we're expecting when we pull that P&L together. So I'm very excited to hear about the panelists and bring the voice of all of my clients that are right now working and running their businesses to advocate on their behalf. Thank you for having me.
Thank you so much, Monique, and to all of our panelists for being here this Tuesday. We're going to transition now into our Q&A and discussion. We've received a lot of questions ahead of time, and we'll also be accepting questions in the Q&A chat function.
And Carly,
yeah,
sorry, if I could, there was a couple things as I looked at the question, a couple things that came up that I just want to make
of
sure I
course.
touch on before we move on to the questions. I mean, first of all, a lot of the questions are about, the problem with healthcare costs that goes way beyond what, the extension of these credits will deal with. And I agree. And I want to be perfectly clear. We need a universal access system of our healthcare. Everybody should be covered. I'm a co-sponsor of Medicare for All. Single payer systems. There are multi-payer systems that work. That's one big thing. Second, the for-profit nature of insurance is extraordinarily problematic and drives up a lot of these costs. And I agree with people who say we should get rid of that, have everybody covered. The Affordable Care Act made significant improvements. We've got much further to go. Second, there are a lot of questions. I did not explain this as clearly as I should. The subsidies end on December 31st. On November 1st, as Ingrid knows very well, that's when people have to start the selection process. They have to pick their plan. You don't just pick the plan automatically on January 1. So now that we're sitting here on November 4th, it creates a little bit of a problem because people are trying to figure out, do I buy this? Do I buy that? What we would do if we can get a negotiation going here is figure out some way to deal with that, to make sure people get the subsidy, even if they elected a more expensive plan, get them the subsidy back. It'll be complicated, but the goal, the objective is to make sure that come December 31st, those subsidies are in place so the premiums don't go up. It gets awkward because we're now past that November 1st deadline, but that's what we're going to try to do. And lastly, and this is just a personal thing, there was a thing in the chat about, well, when members of Congress have to buy health insurance like the rest of us, this will be dealt with. Good news for you. The Affordable Care Act did just that. I am on the ACA. Before that, I was on the Federal Employees Health Benefit Plan, as all federal employees are. But the ACA specifically identified members of Congress and put us on the ACA. So the premium hikes that you're talking about are premium hikes that we are dealing with. And to some extent, your point is valid because Marjorie Taylor Greene, of all people, is really outraged about this. As hardcore a Republican as she is, she wants this dealt with. Why? Because she and her family members are on the ACA and she's seeing the premium increases and the impact that it's having on it. So that's one of the things that we did do in the ACA. With that, I will turn it back over to Carly to go through the questions that we've received and invite our panelists to offer their knowledge in helping to answer them.
Yeah, of course. One of the questions that we've received both before this event and then also as this event has gone on is that the ACA tax credit extensions happened as a response to the COVID-19 pandemic. And was wondering, and maybe Commissioner Cooter, you could start this conversation and other folks can hop in. Could you speak to the need to extend these credits in 2026 and what benefit those credits still offer today?
Yeah, thank you. Well, there's an urgent need to extend the enhanced premium tax credits, especially because, as has been pointed out, open enrollment has already started and people are deciding now whether they can afford coverage. Now, these tax credits have helped millions of people across the U.S. access health care. And here in Washington, some 216,000 people qualified for them last year. And as noted earlier, this has helped bring our uninsured rate down to a historic low of 4.8%. And that's much better than the national average. And that means people are able to access preventative care and there's less reliance on our emergency rooms to provide care, which is the most expensive form of health care and one that taxpayers fund. So if congressional Republicans don't agree to extend the tax credits now, we expect, as I noted earlier, about 80,000 Washingtonians who are mostly healthier and stronger to forego coverage. And that means those who remain on insurance will be less healthy and increasing medical care utilization and driving up costs across the board for everyone. So the reality is the enhanced premium tax credits have worked extraordinarily well. And these credits actually save the taxpayer money. So it's a smart use of our dollars to invest in people's health care. And I agree with Congressman Smith that the for-profit system just isn't working. It's not working for patients. It's not working for providers. And it's not good for our economy overall. It's good for the companies that are taking in that profit, but it's not good for everybody else. But investing in people's health care, that's good for the citizens, that's good for business, and it's good for our economy. So, the reality is Republicans are playing a zero-sum game here. And healthcare is not a zero-sum game. And they need to just stop playing politics with people's healthcare, and they need to get this done now. Because, as I said, people are, they're absolutely looking for healthcare right now. And now is the time that they need to know. And I want to add one other thing. If they were to extend the tax credits, it would be most helpful if they did it as is, because we've already asked the carriers to submit two sets of rates, one with the credits extended and one without. The 21% is what you're seeing is without. If they were to extend the tax credits exactly as is, we would be able to see that drop by 7%. That means the difference for some people between being able to have health care and not. And that can mean the difference between life and death. So this is really critical, and time is running out. And they don't have until December 31st. They need to be acting now.
Does anybody else want to comment on that?
I would like to jump in on that sense of urgency and timing. So just for Washingtonians who purchase on Health Plan Finder here through the Washington Health Benefit Exchange, people are coming in now since Saturday and shopping and experiencing severe sticker shock, many of them. And so the challenge that we have is until Congress acts, we'll already be losing people because they will be afraid of these high prices and making decisions. And once we know that we lose people and they decide to drop coverage, it's very hard to get them back. So here at the exchange, and we've been in deep conversation with you, Commissioner, and with our carrier partners, we stand ready to pass on this relief to our customers if and when Congress acts. As Commissioner said, a clean extension would enable us to do that as quickly as possible. We will do it, and that would be a lot easier. It's really important for Congress to know that every day that goes by, people are running scared from these high prices and leaving the system, and then will end up costing the system more.
Thanks. I just wanted to emphasize a couple of things that the commissioner pointed out on covering everybody. Covering everybody is beneficial not just for the people who are uninsured, but for the entire healthcare system, because it means everyone is participating in the system. Uncompensated care is a huge part of what drives up costs for hospitals and other providers, people who aren't insured, they can't pay. If you get some sort of payment in there, then they are contributing to it, and it doesn't drive up prices for everyone. The other point that the commissioner made that I think is really important is you have to cover everybody. If you allow healthy people to make a decision not to be covered, then that really makes the insurance model difficult, even in a not-for-profit situation. Because for insurance to work, some people have to be paying more than they're getting back. And, if the healthy people stay out, then you're only insuring, sick people who need care. And also, healthy people don't stay healthy forever. I always used to facetiously say, unless you're, I guess, lucky enough to be hit and killed by a bus, you by and large age, or accidents happen, or things happen to you, and then you need health care. So it's really important to get everybody covered, but it's certainly important to cover as many people as you possibly can, which is what we're trying to do with these subsidies under the Affordable Care Act.
And that's actually a great segue to maybe invite Lisa or Decker to talk about community health plans and the impact of those centers that might provide care to folks without insurance. Or if Dr. Gupta, you'd like to talk about the impact on providers. Any of you are welcome to join.
Well, I can jump in first and then others can follow. I think, so from an impact at the community health center, so right now our health insurance navigators and providers are seeing a lot of worry and fear of the cost increases, the affordability of insurance with the sunsetting of these extended premium tax credits, fear of loss of coverage, and fear of the Medicaid changes that are right on the horizon. So real fear and worry around losing access to care. Our navigators continue to support folks through these transitions and through those really hard decisions, as Ingrid mentioned earlier, that individuals and families are going to have to make, reviewing all their coverage options and then leveraging our sliding fee scale as a safety net for those who are priced out of coverage. As a community health center, as I mentioned at the beginning, we will continue to serve everyone in our community, regardless of their insurance coverage. So they'll continue to have access to comprehensive primary care at their community health centers. But we know when folks lose insurance coverage, their access to specialty care, diagnostic services, hospital services will become much more difficult without that coverage. And that will cause folks to delay or forego care, as Dr. Gupta shared. Which we all know leads to worsening health outcomes and to higher costs down the road for everyone. So it's also just harder for our care teams to take care of folks when they don't have insurance, because it really limits their ability to be able to refer patients to those specialty and diagnostic services, and that affects our care providers as well. So community health centers like HealthPoint will continue to serve everyone in the community, regardless of whether they're insured or not. But we absolutely know that when folks are covered, they have better access to care, better outcomes, and again, the total cost of care is managed in a much better way. So it's a real challenge for us as a safety net provider right now, because when demand for services go up, which it will, with more people who become uninsured in our communities, our revenues decrease because those services are not reimbursed at the same level as they are when they're covered. So those are the challenges that we're navigating right now.
couple of items I'll note is, I think one of the one of the really important things that insurance coverage does do is it does provide people access to care at a timely point. So getting preventive care, primary care services when necessary. What we see when people are uninsured is they often don't see a provider until they get very sick and they are in a hospital. Lisa did note that we do, although the community health centers do provide care to anybody regardless of their ability to pay, that comprehensive access is not necessarily there. So we can encourage people to walk into a community health center, but their ability to get comprehensive access to care is still missing. The one other thing I'll note, and we are in the exchange to help supplement the work that we do on the Medicaid line of business, those families who have mixed status families with parents on the exchange and kids who are eligible for Medicaid. There is concern that many of those kids will lose access to care because parents getting access to coverage ensures that their kids also have access to coverage. When we saw the Affordable Care Act go live, we saw about 80,000 kids previously eligible for Medicaid get covered under the Affordable Care Act. So it's a concern both on the commercial line of business, but also on the Medicaid line of business, particularly for many vulnerable kids whose parents are currently being supported by the enhanced premium tax credits today.
I'll just add a bit on. I thought that was all just so beautifully said. For providers across the state of Washington and across the country, my wife's a pediatrician. I'm an adult pulmonologist, and what ends up happening, what we see, not just in our own lived experience, but sort of the downstream impacts that this has on access to care. If people are not able to get timely access to care, what ends up happening is they end up going into an inpatient facility, taking up resources that might have otherwise been deployed for somebody that needed an elective surgery, somebody that needed their cancer screening. If you're utilizing resources to deal with delayed diagnosis of a pneumonia, those resources and that provider time is going to be redirected from something like preventive screenings. And that's exactly what we're seeing. We saw it throughout the pandemic, but we're even seeing this today. As a result of the shutdown, needed screenings to prevent chronic disease are being put off for a variety of reasons. But fundamentally, and we don't talk a lot about this, providers only have so much bandwidth. And you can't AI yourself out of provider time. I know there's a lot of people thinking that AI chatbots are going to somehow make up for provider time, and that's not the case. People ultimately trust nurses, doctors. They're usually 1 and 2 when it comes to health information, especially at this moment of medical falsehoods across the spectrum in the healthcare information or in the healthcare ecosystem and on social media. They trust a human being. And those human beings are not able to fundamentally spend as much time with their patients because the system is filled now. It's completely overloaded with conditions that ideally could be managed at home if we had earlier intervention or through, say, telehealth services that are now being actually put on the back burner because of the shutdown.
Thank you all for those contributions. Next, I'd like to ask Monique a question about the impact that this change will have on those who receive health insurance from not only their employers, but also the people who run small businesses, and how they might be impacted by this.
Thank you for that question. The biggest thing to understand is the ACA marketplace is a key channel for entry-level entrepreneurs and micro and nano business owners really to start to legitimize their access to healthcare. Many of them either have not really understood what that is, and so as they launch their businesses and want to grow living wage jobs themselves, they're hiring others in their own community. Many BIPOC, many veteran, many women-owned businesses are then hiring from their own community. And the strength of that is being able to have upward mobility and being offered access to care. Now, with premiums, beginning to jump and the uncertainty, they're now considering laying off those very entry-level workers of who they created jobs for. So we see a huge ripple effect. But even more than that, many of the ventures clients are owner operators. And I'm so grateful to Congressman Smith for actually visiting with some of our key clients that explained to him how proud they were to have a brick and mortar, with ventures being a co-leasee. We help them get access to capital. We help them get access to all of these business costs. But now something like this that is unplanned for can really throw them for a loop. These micro businesses really do want to help their new employees get access to healthcare coverage, but now they themselves on the exchange having these extended benefits now being declined, they're going to have to reduce hours, which is going to reduce the jobs that they've helped create. Secondly, many of our owner operators themselves are still living within 80% of the area median income of King County and Seattle metro market. So what we stand to do is help them stand up their businesses and the first 5 years become self-reliant, have a strong business model. And when we look at certainty of the expenses and the thinness of their margins, this is a huge decision that these communities that have overcome adversity now have to face when they have to lay off their citizens and their own community partners. It's not a very good feeling, but it's also not economically viable. It's one more empty storefront. It's one more less job that they've created, and especially when they're being very relevant in their communities. So a lot of our clients are now having to decide with a husband-wife business, a mother and daughter business. One of us will not be able to afford healthcare, so I have to cut that position. And then when their loan comes due with us as a CDFI, I can help repay that, but I cannot help put money into their healthcare, their long-term healthcare. And again, many of the clients we serve, especially in communities of color, are culturally relevant daycare and childcare services. That is so needed in our area, especially right now. It's not the huge tech jobs that are getting laid off that we also see, that I'm very sad about, but these are entry-level jobs being affected with an unexpected cost like this coming down on these single owner operators within their first 5 years of business. And as trusted community partners, we've built trust in those communities of low credit, no credit, first-time lenders, first-time borrowers. They're coming to us saying, boy, in the P&L class, we never really talked about how this would happen. So we're not only seeing the social and emotional effects of cutting jobs, now not being able to provide those living wage careers from a trusted employer, we're going to risk seeing more empty storefronts, more broken leases, and more small business owners not being able to empower themselves in upward mobility when they've invested 5 to 6 years of their own time, blood, and sweat equity for something as simple as basic healthcare.
Thank you very much, Monique. That was really useful perspective. The next question I'd like to direct to Commissioner Cooter, but if anyone has thoughts, please feel free to chime in. The ACA credits are a federal policy problems, but what action can Washington state take during this healthcare crisis? And what steps have already been taken?
Yeah, great questions, Carly. So we have worked closely with the Health Benefit Exchange to try to reduce the harm to consumers. And I just want to give a shout out to Ingrid Ulrey and the HBE. They've been fabulous collaborators on how to go about doing this. And we adopted an emergency rule earlier this year that has helped to stabilize premiums for folks getting coverage through the exchange. It's not a total solution, but it definitely helps. And we want people to shop on the exchange and get specific information about plans offered and their costs. Carefully shopping could help consumers find a reasonably affordable plan. And I want to emphasize that because these are scary times and people may think that they won't be able to qualify and they might be pleasantly surprised. So we're getting as much information out as we can so that consumers understand what they're buying. There are health insurance plans offered that don't include all of the protections of the ACA, like rejecting people if they have pre-existing conditions, and we want people to know what they're buying. If you have any questions, please reach out to our office. You can reach us at insurance.wa.gov, and we are more than happy to assist and help and connect you with the health plan finder and the folks over at HBE as well. So thank you. And, you know, it's troubling times right now and people are really, really worried. And I want to go back to just one thing in closing what Congressman Smith said about universal health care. You know, it really is remarkable that we have the only system in the world that's for profit and can't seem to cover everybody. And we know that the way for risk to be distributed the best is for everyone who's affected by the risk to be insured in the pool. And if you're human, you're gonna need health care. So that's why the insurance industry wanted the individual mandate when the ACA was first proposed many years ago, a couple decades ago, but it didn't stick. But that really would have been a smart thing for us to have done. We didn't do it, and now here we are, and we need Congress to act so that people can maintain their health care.
Would anyone else like to chime in on that?
If I could just a comment on the individual mandate, because I don't think this is widely understood. We did include the individual mandate in the ACA, but the question is, so, okay, what if someone doesn't buy insurance? What are you going to do about it? And early on, we had a fine, but eventually that was gotten rid of. So, and this is one of the flaws in universal access systems. The way flaw in not having a universal access system. Most countries that have it, it's part of your taxes. You pay taxes like everything else, and then you have the nation make sure that you are insured so that you avoid that trap. But the other problem is political, and I think we need to be honest about this. I've asked a lot of audiences over the years in different settings, two questions. One, do you think that the federal government should be allowed to mandate that people buy health insurance? And by about an 80 to 90% response rate, people say no. That just sounds bad. Who's the federal government to tell me what I have to do? It seems like an intrusion upon your individual rights. And I get that. But then I ask the second question, do you think that our society then should make sure that everybody has access to affordable basic health care? Same percentages, 80, 90% people say, yeah, of course. And one of my missions, which thus far has not been successful, is to explain to people that you can't hold those two positions at the same time, not in the real world at any rate. Because if you set up a system that says, okay, we're going to cover everybody when they want to be covered, but we're not going to require them to pay into the system, then as I said earlier, the system collapses. In fact, we had experience with that in Washington State. I think this might have been before Patty's time in the legislature and shortly after mine. But we passed a system to allow people to opt into, I forget what they called it, a basic health plan. And what happened was a lot of people were opting in, like if they got pregnant, or they were opting in if they had some healthcare need, and then they were opting out. And that system just exploded in cost. And a year or so into it, I forget the exact timeline, they had to readjust that and fix that because you simply can't have a health insurance system that only covers people when they need the coverage. So all of us are going to have to sort of think about how to balance those competing wants. Yeah, we want to be able to be free to make our own decisions. We also don't want to be in a situation where we get sick or a loved one gets sick and we can't cover the cost of that. And we can't have it both ways if we're going to have a healthcare system that covers everybody in the fairest possible way.
Congressman Smith, the next question was actually for you. Out of curiosity, what do you think the likelihood of finding a compromise on the federal level that will address this healthcare crisis be, whether in the next few weeks, next few months?
Yeah, I think it's likely. I mean, it's disappointing. And look, Congress has become more and more partisan. There's no question about that. There's a lot of blame to go around. I'll grant you that. But I'll tell you, having been with Democrat and Republican presidents back here as a member of Congress, President Trump has done this budget in the most partisan way possible. I saw one comment in the chat saying, well, gosh, this is the continuing resolution is just, the same basic budget the Democrats and Republicans have been passing for some time. No, no, it is very much not. Okay. And ask any of the 200,000 federal employees who have been fired about that. Or as I mentioned, the cuts that have happened to programs. President Trump has zeroed out various different programs. He's frozen funds that were previously appropriated by those Congresses to the tune of well over $400 billion. Now, in some cases, they've unfrozen them. which has been confusing for people. But they've also canceled programs, canceled energy programs, clean energy programs, wind, solar programs have been canceled. He's canceled transportation projects, specifically focusing on targeting places that are Democrat programs. I mean, tens of billions of dollars. So no, this is not a normal budget process. You've seen all of the firings of anyone who has said something bad about President Trump or the Justice Department. Anyone who was engaged in investigations that Trump didn't like has been fired. So please don't tell me the Democrats just aren't voting for the normal budget process. I mean, you have to really not have been paying attention to the last 10 months, whether you're a Republican or Democrat. Maybe some of you say, damn straight, he should have done that. He should have cut those programs. He should have fired them. Fine. I don't agree with it. And now you're telling me to vote for it. That's where the inconsistency comes in. All of that said, two things. One, now that we are on November 4th and the urgency of the healthcare crisis, is not being addressed by the Republican majority, we're not getting them to pay attention to what we want them to pay attention to, number one. Number two, what we've seen from President Trump is in this shutdown, he is trying to maximize the amount of pain on the American people. We've seen that with the SNAP benefits. We set aside in Congress an emergency fund, billions of dollars that could easily pay the SNAP benefits for at least a couple of months. And he made the conscious decision not to do that. Interestingly, when he vetoed keeping the government open back in 2019, he used that emergency fund to pay SNAP benefits. So they are trying to inflict a maximum amount of pain on the American people in the hopes that people will respond to some in the chat, oh, it's the Democrats' fault. Okay, now, that said, I'm a reasonable person, and if they are going to do that, I don't want to inflict pain upon the American people. And if that is where President Trump is at, yeah, that adds a little urgency to saying, okay, we didn't get what we wanted. We're going to try to find a way to open up the government. Discussions are ongoing now in the Senate about something that would open it up, push the date further than November 21st. It would also give some promise of negotiating on some of these issues and pass some appropriations bills that there is agreement on. And that may well make sense at this point. I think that's likely to happen. And then the final point is, okay, what is all of that? How does all that impact the very issue that we're talking about today? I don't think Republicans want to be responsible for people's healthcare premiums skyrocketing the way they are going to. I think some compromise is likely to be achieved now, as has been pointed out by several of our guests. The longer that takes, the more pain that is inflicted upon people. Because, yeah, the subsidies run out on December 31st, but your decision is now. And you can't wait for that, which is, again, why we said there was urgency in doing this and why we were willing to take the understandable risk. We knew the risks of the impact on a variety of different issues of not funding the portions of the government past October 1st. We understood that risk, but it was really important. So every day that we don't do it is a problem, but the sooner we do it, the better. And I'm passingly confident that we'll probably get the government open early next week or late this week. And then, I don't know, 2-3 weeks. Hopefully, I would hope for sooner, but just asking for my predictive abilities here. I would say it'll take a little while, but I think we will get there on something.
That makes a lot of sense. Thank you, Congressman. For our final question, I'd like to ask each of our panelists, for folks who are listening and they want to get involved in advocating on this issue, or they want to see change in this realm, how would you suggest they go about it? And I'd like to start with Dr. Gupta, if possible.
Sure. No, thank you for the question again, for this opportunity. Congressman Smith and I had this opportunity to have a conversation about messaging and what works. And I don't think anybody really has all the right answers here, but I will say what seems to work when it comes to persuasion and reaching a majority of people. You're not going to make everybody happy. Patient level stories and making it about patients and the impacts of these cuts. Again, maybe avoiding statistics, but talking about the impacts you've seen with your family, or maybe it's a friend or somebody in the neighborhood. That to me is as resonant as it's going to get. But if you can map whatever is happening at the DC policy level to ways in which it's going to impact you, your families, or your loved ones, that's powerful. And if you can do that in a way that's non-judgmental, that doesn't cast blame, that doesn't actually focus on a person, but specifically on the policy, I've personally found that that has a way of having some resonance. And if you can do it on social media, especially because there's scale there, even better.
Let's go to Ingrid next.
Thank you. I'm going to get it down to the personal level and encourage people to prioritize taking care of themselves, their family, and their community by making sure everyone's getting covered. There's a lot of scary news out there about sticker shock, and we're all concerned about rising prices, but don't let that keep people from coming in to Washington Health Plan Finder, this open enrollment. In the chat is our customer support center phone number and the website to get in. Health insurance is expensive and it's confusing, and it's ever more complex this year. So while some folks will see high prices, I want to underscore that important state actions have been taken, including, thank you, Commissioner, the emergency rule issued, as well as our state premium assistance program. We're going to do the best we can to keep healthcare affordable and mitigate as many losses as possible on the market this year. So people may well be surprised by what they find. So come into Health Plan Finder, support your kids, your 20-somethings, make sure they do it too. We need those young, healthy folks in the market. And also know that in community, we have thousands of in-person navigators, assisters, and brokers across the state of Washington who can work with folks across hundreds of languages and work in person and make sure people have the support they need to get covered. That's where I end with. Thank you.
Next, let's go to Lisa.
Holly. So at HealthPoint, we believe everyone deserves great care. And we know that when everyone in our community has their best opportunity for health and well-being, that we are all better off. We're going to continue to advocate that for access to care and access to coverage. And we encourage others to do so by sharing their stories, as Dr. Gupta mentioned. Every single person has had an experience with healthcare and the healthcare system. And so it is one of those things that people can connect with. And so please continue to share your stories. The health centers in Washington actually have a website or a platform called Save Healthcare in Washington. That was a grassroots advocacy platform that was developed by the community health centers across Washington state. And you can go there and find opportunities to engage in advocacy.
Thank you. Becker, would love to go to you next.
Perfect. I'll just piggyback off of Lisa's last statement. So it's actually folks on my team that run the Safe Healthcare in Washington advocacy platform. It is a grassroots advocacy platform that allows patients and staff from our community health centers to get messages directly to their lawmakers. I'll put the link to the newsletter in here. This will allow you to sign up both for the newsletter and then also for action alerts. So this is a great way to be involved and advocate for both the community health centers and then the larger communities that they serve as well.
Thank you. We'll go to Monique next.
Fantastic. Thank you so much. And again, on behalf of the micro and nano businesses that I serve, thank you for allowing me to be their voice. I think what I'm going to ask my fellow panelists is to look to organizations like Ventures, trusted voices in the community for the most underrepresented micro and nano businesses. They're not necessarily parts of large chambers or large registered statewide organizations. They really do come to their community partners as trusted voices. So lean on us to get this message out. We do it in Spanish and in English, and we do it with care and with a trusted partnership. And then for those listening, I really hope that they understand these micro nano businesses want to pay into this system. It is still the American dream. And when America is the one holding them back, it's really tough to overcome. A lot of my business owners overcame not great working conditions, not great living wages. So when they put everything on the line to launch their own businesses, they do it to be a better employer than they had when they were employees. And having these tax benefits, quickly escalate and taken away from them is really unpredictable. And so if you can even just make decisions with your dollar, shop micro, nano, and local, these clients that we serve really want to continue to pay into a tax system. They want to pay into their rent. They want to be contributing people. But while we can face the inequities and help them overcome them, things like this and the government shutdown are very, very hard to navigate. So we continue to work diligently with a leaner staff than ever before. But thank you for letting us share their voice, because that and shining the light on it is very powerful.
Thank you very much, Monique. And Commissioner Kuderer, you could go.
Thank you. And thank you again, Congressman Smith, for convening this. Really, really appreciate it. It's an important discussion. You know, when I was traveling around the state working to earn this position, healthcare was the #1 issue I heard about. Time and time again, people would tell me about how challenging it was for healthcare, the costs. And one of the things that the industry hates above all is uncertainty. And that's the one thing that is for certain coming out of the other Washington right now, is uncertainty. And that's also contributing to the volatility of the healthcare prices that we're seeing. So what I would say to people is your stories matter to me. That's why I'm here right now. That's why this has been a focus for me as commissioner. And your stories will matter to your congressional delegation. And if you need help finding who they are and their numbers, you let us know, or Congressman Smith, I'm sure, can also put you in touch if he's not yours. But I can tell you that your stories relayed to the congressional delegation will go really, really far. And I would urge Congress, when they reopen, and I hope that is soon, that they also at the same time extend those enhanced premium tax credits, because every single day that they're not extended, people drop off, and it's going to be hard to get them back. And that is going to have an impact on those families, those individuals, and also on the system as a whole. So that's what I would encourage folks to do. And also feel free to reach out to the Office of the Insurance Commissioner. Again, insurance.wa.gov. We are a consumer advocacy and protection organization, and we're here to help. Thank you.
Thank you, Commissioner. And I'll turn it over to Congressman Smith for any final closing remarks.
I just want to say I completely agree with what the 6 panelists said about how to get involved. Don't have anything to add on that. I think it's just the spot on right approach. You know, make it personal, get involved, contact your legislators. The only thing I would close by saying is, you know, stay persistent in that. I know how frustrating it can be, how important the issues are. You know, you make a phone call, go to a rally, meet with people, and you don't get the change you want. Keep at it. It takes time, and it really is having an impact. I know, you know, I've talked about the shutdown, a lot of different pieces of it. It's not easy. It's difficult, not something that I'm happy about in terms of how it's impacting the country. But I'll tell you, there is a heck of a lot more attention right now to this healthcare crisis than there otherwise would be. So if you keep your voices loud, it does have an impact. People hear it, and I will still be cautiously optimistic that we'll deal with this not as soon as we should or should have. But I think your voices are really starting to have an impact. People are hearing the stories, seeing the impacts that it's having on people's lives, and we want to find out, you know, we want to address that. So keep that up. Thank you. Thanks to Carly for organizing this, and thanks to the panel, all 6 of you. Appreciate the work you're doing in your own capacity and for participating with our forum tonight. And with that, I'll turn it back over to Carly to close us out.
Perfect. Thank you so much, Congressman. And thank you to all of our panelists for spending some time on this Tuesday afternoon with us to discuss this very important and visceral issue for many constituents of Washington's 9th and constituents across Washington state. If you were unable to get your question answered here today, please feel free to reach out to our office at adamsmith.house.gov, and we'll be more than happy to try to get you a response to your question or get you in contact with anyone that you need to get in contact with. Again, thank you all for your time. This video recording will be accessible on YouTube and will live on if you ever need to refer back to it. Thank you and have a good night.